AMCA Healthcare Certification Questions, 115 questions with explained answers. Question 1. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 2. Postprandial means. Option A, before a meal. Option B, before bedtime. Option C, fasting. Option D, after a meal. The correct answer is option D, after a meal. Explanation. Postprandial means after a meal, so a postprandial measurement or instruction is timed after eating. Question 3. When medical assistants are able to adapt to various situations, they are considered to be: Option A, courteous. Option B, flexible. Option C, dependable. Option D, loyal. The correct answer is option B, flexible. Explanation. Flexibility is the ability to adjust behavior or plans when circumstances change, which is important in a busy medical office. Question 4. During assessment, the best source from which to obtain patient information is the: Option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is option A, the medical record. Explanation. The medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 5. Important information a patient should know about immunizations would be that: Option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B, they are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 6. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 7. Also known as problem-oriented medical record, is a method of tracking the patient's problems during the time they are receiving medical care. Option A, problem-oriented model records. Option B, problems on medical records. Option C, problem-oriented medical record charting. Option D, prognosis on medical record charting. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 8. A fluctuating fever that returns to or below baseline then increases again is: Option A, intermittent. Option B, remittent. Option C, onset. Option D, continuous. The correct answer is option A, intermittent. Explanation. An intermittent fever returns to normal or below the fever threshold between episodes before rising again. Question 9. The primary purpose of wearing gloves during phlebotomy procedures is to protect the: Option A, venipuncture site from contamination by the phlebotomist's hands. Option B, specimen from contamination by the phlebotomist. Option C, patient from contamination by the phlebotomist. Option D, phlebotomist from exposure to the patient's blood. The correct answer is option D, phlebotomist from exposure to the patient's blood. Explanation. Gloves provide a barrier that reduces the phlebotomist's direct skin exposure to the patient's blood and other potentially infectious material. Question 10. Choose the answer that corresponds with number C. Option A, radial artery. Option B, brachial artery. Option C, ulnar artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 11. Which of the following is not true regarding Health Insurance Portability and Accountability Act laws? Option A. Patients can make informed choices regarding how their personal health information is used. Option B. Few boundaries are set on the use and release of health records. Option C, patients have more control over their medical records. Option D, violators are held accountable if patient privacy rights are compromised. The correct answer is option B, few boundaries are set on the use and release of health records. Explanation: the statement that few boundaries exist is false because the Health Insurance Portability and Accountability Act privacy rule places important limits on how protected health information may be used and disclosed. Question 12. This unit in the hospital is run by physicians and experts in the field of musculoskeletal disorders of bones, joints, ligaments and tendons. Identify this department. Option A, rheumatology. Option B, obstetrics. Option C, ophthalmology. Option D, oncology. The correct answer is option A, rheumatology. Explanation: rheumatology focuses on disorders involving joints and connective tissues, including many conditions that affect bones, ligaments, tendons, and surrounding structures. Question 13. Managed care organizations control costs by: Option A, limiting patient enrollment. Option B, detecting risk factors early. Option C, discouraging patient visits. Option D, eliminating case managers. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 14. What specimens require protection from light? Option A, bilirubin. Option B, lactic acid. Option C, blood gases. Option D, cryofibrinogens. The correct answer is option A, bilirubin. Explanation: bilirubin breaks down when exposed to light, so specimens for bilirubin testing are protected from light to help preserve an accurate result. Question 15. Another name for chest leads is: Option A, standard. Option B, precordial. Option C, limb. Option D, augmented. The correct answer is option B, precordial. Explanation: precordial leads are the chest leads placed across the front of the chest to view electrical activity from different horizontal angles. Question 16. Which chest lead is placed on the right sternal border in the fourth intercostal space? Option A, V3. Option B, V1. Option C, V2. Option D, V4. The correct answer is option B, V1. Explanation: chest lead V1 is placed at the fourth intercostal space along the right sternal border. Question 17. The three kinds of blood cells are: Option A, leukocytes, red blood cells, erythrocytes. Option B, erythrocytes, platelets, thrombocytes. Option C, leukocytes, white blood cells, platelets. Option D, erythrocytes, thrombocytes, leukocytes. The correct answer is option D, erythrocytes, thrombocytes, leukocytes. Explanation: the three major formed elements of blood are erythrocytes, leukocytes, and thrombocytes, which are red blood cells, white blood cells, and platelets. Question 18. The correct lead from the right arm to the leg is: Option A, augmented voltage right arm lead. Option B, augmented voltage foot lead. Option C, lead 3. Option D, lead 2. The correct answer is option D, lead 2. Explanation: standard limb lead 2 records the electrical potential from the negative right arm electrode toward the positive left leg electrode. Question 19. Which of the following procedures can be performed by a medical assistant? Option A, intramuscular injection. Option B, start fluids through a catheter. Option C, insert peripheral catheter. Option D, intravenous injection. The correct answer is option A, intramuscular injection. Explanation: intramuscular injections are within the usual delegated clinical duties of a properly trained medical assistant when permitted by state law and office policy, while intravenous procedures may require different authorization. Question 20. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation: bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 21. The patient's specimen is lipemic. This is usually an indicator that the patient is: Option A, smoking. Option B, not fasting. Option C, normal. Option D, in basal state. The correct answer is option B, not fasting. Explanation: lipemia makes serum or plasma look cloudy or milky because of excess circulating lipids and can occur when a patient has not fasted before collection. Question 22. Name this part of the electrocardiogram. Option A, R2R interval. Option B, ST segment. Option C, PR segment. Option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 23. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed. Option A, 2,000 liters. Option B, 2,000 milliliters. Option C, 400 milliliters. Option D, 750 milliliters. The correct answer is option B, 2,000 milliliters. Explanation. The source uses about 2,000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition. Question 24. Which of the following is considered a parasitic infection? Option A, Lyme disease. Option B, rabies. Option C, ringworm. Option D, malaria. The correct answer is option D, malaria. Explanation. Malaria is caused by Plasmodium parasites that are transmitted through the bite of infected mosquitoes, so it is a parasitic infection rather than a bacterial, viral, or fungal disease. Question 25. The tube of choice for glucose testing is: Option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 26. A patient's weight should be listed in the patient's chart to the nearest. Option A, pound. Option B, 1/2 pound. Option C, ounce. Option D, 1/4 pound. The correct answer is option D, 1/4 pound. Explanation. The source keys 1/4 pound as the charting precision. This is a documentation convention from the source and should be matched to the policy or equipment standard used in the course. Question 27. Sodium citrate is the additive in what color tube? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option C, light blue. Explanation. Light blue tubes contain sodium citrate, an anticoagulant used primarily for coagulation testing because it binds calcium in a controlled ratio. Question 28. A pounding or racing of the heart, such that the patient is aware of his and her heartbeat, is called a and. Option A, palpitation. Option B, ectopic beat. Option C, hemoptysis. Option D, arrhythmia. The correct answer is option A, palpitation. Explanation. A palpitation is the sensation of being aware of a forceful, rapid, irregular, or pounding heartbeat. Question 29. Muscles that act on the knee joint exhibit two actions. Option A, adduction and lateral rotation. Option B, medial rotation and extension. Option C, adduction and abduction. Option D, flexion and extension. The correct answer is option D, flexion and extension. Explanation. The knee primarily moves through flexion and extension, which bend and straighten the joint. Question 30. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing: Option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation. A fast regular rhythm with a normal upright P wave before every narrow QRS complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 31. When performing a dermal puncture and the lancet hits the bone, what is the potentially serious fatal bone infection that could occur? Option A, osteochondritis. Option B, osteomyelitis. Option C, osteomalacia. Option D, osteoporosis. The correct answer is option B, osteomyelitis. Explanation. Osteomyelitis is an infection of bone. A lancet that penetrates too deeply during a dermal puncture can potentially introduce infection near the bone. Question 32. All pathogens are: Option A, microorganisms that live in soil. Option B, microbes that can cause disease. Option C, communicable microorganisms. Option D, normal bacteria found on skin. The correct answer is option B, microbes that can cause disease. Explanation. A pathogen is a microorganism or other infectious agent capable of causing disease in a host. Question 33. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Option D, the one collected in a tube with no additive. The correct answer is option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Explanation. The source keys the tube containing ethylenediamine tetrashic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 34. A blood sample is collected from a patient and the plasma is pink to red in color. Which of the following is the most likely cause? Option A, polycythemia. Option B, hemolysis. Option C, lipema. Option D, agglutination. The correct answer is option B, hemolysis. Explanation. Hemolysis releases hemoglobin from ruptured red blood cells, which can make serum or plasma appear pink to red. Question 35. Which of the following is an example of negative kind 6? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kind 6 refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 36. When a patient fails to show for their appointment, the event must be: Option A, erased from the schedule. Option B, written on a no-show log. Option C, monetarily charged to the patient. Option D, documented in the patient's chart. The correct answer is option D, documented in the patient's chart. Explanation. Documenting a missed appointment creates a clear record that the patient did not attend and supports follow-up, continuity, and risk management. Question 37. Identify the rhythm that will often produce an irregular rhythm. Option A, atrial tachycardia. Option B, sinus dysrhythmia. Option C, ventricular tachycardia. Option D, sinus bradycardia. The correct answer is option B, sinus dysrhythmia. Explanation. Sinus dysrhythmia produces a rhythm that varies with the respiratory cycle, so the intervals between beats can appear irregular while the impulses still originate in the sinus node. Question 38. How do you know when you have achieved adequate ventilation for a patient when doing cardiopulmonary resuscitation? Option A, air escapes the nose. Option B, air enters the stomach. Option C, rise of the chest. Option D, you hear a popping sound. The correct answer is option C, rise of the chest. Explanation. Visible chest rise shows that enough air is entering the lungs to expand the chest during rescue ventilation. Question 39. The amount of blood pumped by the heart per minute is called: Option A, ejection fraction. Option B, cardiac output. Option C, contractility. Option D, blood pressure. The correct answer is option B, cardiac output. Explanation. Cardiac output is the volume of blood the heart pumps in 1 minute and is commonly described as heart rate multiplied by stroke volume. Question 40. Choose the answer that corresponds with number E. Option A, basilic vein. Option B, radial artery. Option C, cephalic vein. Option D, median cubital vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 41. Information given by a patient to medical personnel that cannot be disclosed without consent constitutes: Option A, duty of care. Option B, negligence. Option C, judgment. Option D, privileged communication. The correct answer is option D, privileged communication. Explanation. Privileged communication is confidential information shared within a protected professional relationship and is not normally disclosed without authorization or another lawful basis. Question 42. The functional unit of the kidney is the: Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 43. Which of the following supplies blood to the heart muscle? Option A, coronary arteries. Option B, brachial arteries. Option C, carotid arteries. Option D, cerebral arteries. The correct answer is option A, coronary arteries. Explanation. The coronary arteries branch from the aorta and deliver oxygenated blood directly to the heart muscle. Question 44. There are two types of civil actions healthcare providers for injuries resulting from healthcare. The first one is lack of informed consent and the second one is Option A, violation of standard of care. Option B, trial and post-trial. Option C, violation of confidentiality. Option D, violation of continued care plan. The correct answer is option A, violation of standard of care. Explanation. A violation of the standard of care occurs when a healthcare provider fails to act with the level of skill and care expected under similar circumstances. Question 45. Which of the following skills would not be an appropriate expectation of the competent medical assistant? Option A, giving instructions to patients about self-care after treatments. Option B, diagnosing common patient symptoms. Option C, performing insurance coding and billing. Option D, using the computer to perform a variety of office functions. The correct answer is option B, diagnosing common patient symptoms. Explanation. Diagnosing symptoms is a provider-level clinical responsibility and is not an appropriate independent duty for a medical assistant. Question 46. The Q wave, if present, is always option A, positive. Option B, present. Option C, isoelectric. Option D, negative. The correct answer is option D, negative. Explanation. A normal Q wave, when present, is the first negative deflection of the Q or S complex before the first positive R wave. Question 47. Choose the answer that corresponds with number D. Option A, ulnar artery. Option B, radial artery. Option C, brachial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 48. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the Option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 49. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation. The ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 50. Which choice is a typical educational for elderly patients to prevent disease? Option A, the location of the patient's public health resources in their community. Option B, health anti-aging skin care techniques and products. Option C, sterile technique used in the medical practice. Option D, annual flu pneumonia vaccination information. The correct answer is option D, annual flu pneumonia vaccination information. Explanation. Vaccination education is an important preventive topic for older adults because immunization can reduce the risk of serious respiratory infections and related complications. Question 51. What is the function of the large intestine, also known as colon? Option A, absorb water. Option B, absorb sugar. Option C, absorb fat. Option D, absorb vitamins. The correct answer is option A, absorb water. Explanation. The large intestine absorbs water and electrolytes from intestinal contents and helps form and store feces. Question 52. Complete destruction of all forms of microbial life. Option A, sterilization. Option B, germicide. Option C, sanitization. Option D, disinfection. The correct answer is option A, sterilization. Explanation. Sterilization destroys all forms of microbial life, including bacterial spores, which distinguishes it from cleaning and most disinfection processes. Question 53. Without a clot activator, whole blood typically clots in minutes. Option A, 60 to 20. Option B, 1 to 2. Option C, 30 to 60. Option D, 5 to 10. The correct answer is option C, 30 to 60. Explanation. Without a clot activator, blood in a plain collection tube may require about 30 to 60 minutes to clot completely before centrifugation. Question 54. Which of the following is correct regarding contact transmissions? Option A, it involves the transfer of pathogens by food and water. Option B, it involves contaminated instruments, needles, or contaminated hands that are not washed. Option C, it involves transmission of pathogens that remain suspended in air for a long period of time. Option D, it refers to the transfer of pathogens by mosquitoes, flies, and rats. The correct answer is option B. It involves contaminated instruments, needles, or contaminated hands that are not washed. Explanation: indirect contact transmission can occur when pathogens are transferred by contaminated instruments, surfaces, or hands that have not been properly cleaned. Question 55. Identify the tubes needed to collect a prothrombin time, immediate electrolytes, and blood culture in the proper order of collection. Option A, yellow, light blue, plasma separator tube. Option B, serum separator tube, yellow, light blue. Option C, light blue, lavender, yellow. Option D, gold, yellow, light blue. The correct answer is option A, yellow, light blue, plasma separator tube. Explanation: the keyed sequence places the blood culture collection first, followed by the light blue coagulation tube and then the plasma separator tube for electrolytes. Question 56. Is usually sponsored and partially paid by an employer. Option A, TRICARE. Option B, private insurance. Option C, workers' aid. Option D, group health insurance. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 57. Which drug is used as an anticoagulant? Option A, fluoxetine Prozac. Option B, warfarin Coumadin. Option C, digoxin Lanoxin. Option D, triazolam halcyon. The correct answer is option B, warfarin Coumadin. Explanation: warfarin is an anticoagulant that reduces formation of vitamin K-dependent clotting factors and is used to reduce the risk of harmful blood clots. Question 58. Regulation of the heart rate, speed of electrical conduction and strength of contraction are influenced by the brain via the nervous system. Option A, autonomic. Option B, somatic. Option C, core. Option D, voluntary. The correct answer is option A, autonomic. Explanation: the autonomic nervous system regulates involuntary cardiac functions such as heart rate, conduction speed, and force of contraction through sympathetic and parasympathetic influences. Question 59. Verbal facial expressions or body language, such as a nod of understanding, are called. Option A, external noise. Option B, internal noise. Option C, channels. Option D, feedback. The correct answer is option D, feedback. Explanation: feedback is the receiver's response that shows whether a message was understood, and it can be verbal or nonverbal, such as a nod. Question 60. What drug prevents the action of another drug or chemical? Option A, trade. Option B, narcotic. Option C, synergist. Option D, antagonist. The correct answer is option D, antagonist. Explanation: an antagonist blocks or reduces the action of another drug or chemical by opposing its effect at a receptor or through another mechanism. Question 61. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation: airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 62. Azystole. Option A, is defined as the presence of chaotic cardiac activity. Option B, produces a complete cessation of cardiac output. Option C, is the most common primary event in cardiac arrest in the adult. Option D, appears as a chaotic line on the electrocardiogram monitor. The correct answer is option B, produces a complete cessation of cardiac output. Explanation: azystole means the absence of effective ventricular electrical activity and therefore no effective cardiac output. Question 63. The physician prescribes a buccal medication. The medical assistant should instruct the patient to: Option A, place the medication between the lower teeth and cheek. Option B, chew the medication and swallow it. Option C, place the medication under the tongue. Option D, dissolve the medication in water and drink it. The correct answer is option A, place the medication between the lower teeth and cheek. Explanation: a buccal medication is designed to dissolve between the cheek and gum so the drug can be absorbed through the lining of the mouth. Question 64. The body organ targeted by hepatitis B virus is the: Option A, brain. Option B, liver. Option C, heart. Option D, lungs. The correct answer is option B, liver. Explanation: hepatitis B virus primarily infects liver cells, so the liver is the main organ affected by the disease. Question 65. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 66. Which of the following procedures is appropriate for preparing blood and other potentially infectious materials for transport? Option A, freezing the materials before transport. Option B, placing the materials in a leak-proof container during collection. Option C, decontaminating the hazardous waste container. Option D, relabelling containers provided for waste. The correct answer is option B, placing the materials in a leak-proof container during collection. Explanation. Potentially infectious specimens must be placed in leak-resistant containers so blood or body fluid cannot escape during handling and transport. Question 67. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A, the medical assistant can use capillary tubes for the blood collection. Option B, draw a red top tube before the light blue tube. Option C, fill a light blue to the top. Option D, before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D, before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 68. A normal resting heart rate for the average adult is: Option A, 15-20 beats per minute. Option B, 80-120 beats per minute. Option C, 10-15 beats per minute. Option D, 60-100 beats per minute. The correct answer is option D, 60-100 beats per minute. Explanation. A normal resting adult heart rate is commonly taught as 60 to 100 beats per minute, with individual variation based on age, fitness, medications, and health status. Question 69. Thixotropic gel, found in the serum separator tube red-gray marbled topped vacutainer tube. Option A, is more dense than red blood cells and less dense than white blood cells. Option B, is more dense than red blood cells and less dense than serum. Option C, is less dense than red blood cells but more dense than serum. Option D, has the same density as red blood cells. The correct answer is option C, is less dense than red blood cells but more dense than serum. Explanation. During centrifugation, separator gel moves between the denser blood cells and the less dense serum, creating a stable physical barrier between them. Question 70. Which of the patient's limbs serves as an electrical ground? Option A, right arm. Option B, left leg. Option C, left arm. Option D, right leg. The correct answer is option D, right leg. Explanation. In a standard electrocardiogram setup, the right leg electrode serves as the reference or ground electrode and is not used to form the main diagnostic limb leads. Question 71. Dr. Jones and Dr. Brown decide to share a practice. Together, they share patients, expenses, profits, and assets. Which type of medical practice is this? Option A, group practice. Option B, clinic. Option C, partnership. Option D, sole proprietorship. The correct answer is option A, group practice. Explanation. A group practice is formed when multiple physicians practice together and share resources such as patients, expenses, income, and facilities. Question 72. The main purpose of personal protective equipment is to: Option A, help project a professional appearance. Option B, protect street clothes from getting soiled. Option C, provide the employee a barrier against infection. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option C, provide the employee a barrier against infection. Explanation. Personal protective equipment creates a barrier between the worker and potentially infectious material, reducing exposure to blood, body fluids, droplets, or other hazards. Question 73. To indicate that something lies nearer the surface, use the term: Option A, distal. Option B, deep. Option C, superficial. Option D, proximal. The correct answer is option C, superficial. Explanation. Superficial means closer to or at the body surface, while deep describes a structure farther from the surface. Question 74. To determine our ventricular pulse, the electrocardiogram technician would: Option A, calculate the ST repolarization segments. Option B, calculate the spacing between the P waves. Option C, calculate the spacing between the ventricular repolarization T waves. Option D, calculate the spacing between the QRS complexes. The correct answer is option D, calculate the spacing between the QRS complexes. Explanation. Ventricular rate is determined from the spacing of the QRS complexes because each QRS complex represents ventricular depolarization and normally corresponds to one ventricular beat. Question 75. Which of the following should be used to chill a specimen as it transported? Option A, a small freezer unit. Option B, frozen blocks of ice. Option C, crushed ice. Option D, tepid water. The correct answer is option C, crushed ice. Explanation. Crushed ice surrounds the specimen closely and provides efficient chilling when a test requires transport at a low temperature. Question 76. What organ's main function is to eliminate excess water and waste products from the body? Option A, liver. Option B, intestines. Option C, gallbladder. Option D, kidneys. The correct answer is option D, kidneys. Explanation. The kidneys filter the blood, remove metabolic waste, regulate water and electrolytes, and excrete excess substances in urine. Question 77. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 78. The boundaries for the approved area in performing heel punctures are: Option A, the line extending from the third toe, dividing the plantar surface into medial and lateral aspects. Option B, the line extending from the third and fourth toe, dividing the plantar surface. Option C, the lateral line extending from the third toe and the medial line extending from the second toe. Option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. The correct answer is option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. Explanation. Heel punctures are limited to the approved medial and lateral plantar areas to reduce the chance of injuring the heel bone, nerves, and vessels. Question 79. Demerol 75 mg, intramuscular every 4 hours, as needed for severe pain, is what type of medication order? Option A, single. Option B, as needed. Option C, immediate. Option D, routine. The correct answer is option B, as needed. Explanation. The phrase as needed means the medication is given only when the patient meets the stated need, so this is an as needed medication order rather than a routine or one-time order. Question 80. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called: Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 81. The National Health Insurance Plan for Americans age 65 and older is: Option A, Civilian Health and Medical Program of the Department of Veterans Affairs. Option B, Medicaid. Option C, TRICARE. Option D, Medicare. The correct answer is option D, Medicare. Explanation. Medicare is the federal health insurance program that primarily covers people age 65 and older and also covers certain younger people who meet eligibility criteria. Question 82. Faithfulness, or allegiance to a cause, ideal, custom, institution or product, is called: Option A, loyalty. Option B, dependability. Option C, courtesy. Option D, flexibility. The correct answer is option A, loyalty. Explanation. Loyalty means faithfulness or allegiance to a person, organization, cause, or principle. Question 83. Which of the following types of filing systems requires a cross-reference files? Option A, alphabetic. Option B, subject. Option C, geographic. Option D, numeric. The correct answer is option D, numeric. Explanation. Numeric filing systems require an alphabetical cross-reference or index so staff can locate the patient's assigned number from the patient's name. Question 84. The 4 symptoms of inflammation are erythema, edema, pain, and: Option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation. The classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 85. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 86. The way to organize appointment scheduling so that it best supports the success of the practice is to: Option A, include a lot of time physician's administrative activities. Option B, allow frequent breaks. Option C, consider the preferences of the physician. Option D, schedule as many patients as possible throughout the entire day. The correct answer is option C, consider the preferences of the physician. Explanation. Considering the physician's working preferences helps create a realistic schedule that supports workflow, patient access, and the way the practice is actually run. Question 87. Another term for outpatient care is: Option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is option C, ambulatory care. Explanation. Ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care. Question 88. This is federal program that provides medical care for the indigent. Option A, Public Health Service. Option B, Medicaid. Option C, Medicare. Option D, Health Insurance Portability and Accountability Act. The correct answer is option B, Medicaid. Explanation. Medicaid is a joint federal and state program that provides health coverage to eligible people with limited income and other qualifying circumstances. Question 89. The acronym used to remember the actions to take when using a fire extinguisher is: Option A, ACT. Option B, help. Option C, rescue, alarm, confine, and extinguish or evacuate. Option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. The correct answer is option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. Explanation. The fire extinguisher sequence is pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side so the extinguishing agent is directed effectively. Question 90. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A, retractor. Option B, speculum. Option C, hemostat. Option D, forceps. The correct answer is option B, speculum. Explanation. A speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 91. Which of the following cannot be handled by the medical assistant? Option A, patient requesting emergency medical advice. Option B, new patient and return appointments. Option C, directions to the facility. Option D, whether or not a physician is in a certain health plan. The correct answer is option A, patient requesting emergency medical advice. Explanation. A request for emergency medical advice requires clinical assessment and decision-making beyond routine administrative handling by a medical assistant and should be escalated according to office protocol. Question 92. A physician, specialist, or any person that provides medical care is known as the: Option A, provider. Option B, policyholder. Option C, subscriber. Option D, dependent. The correct answer is option A, provider. Explanation. A provider is a healthcare professional or organization that supplies medical services to patients. Question 93. The patient information sheet contains: Option A, the past medical history of the patient. Option B, the patient's past family history. Option C, the patient's chief complaint. Option D, patient's personal and insurance information. The correct answer is option D, patient's personal and insurance information. Explanation. The patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 94. Which of the following is classified as abnormally rapid, deep, or labored breathing? Option A, hypertension. Option B, tachypnea. Option C, hypernia. Option D, hyperpyrexia. The correct answer is option B, tachypnea. Explanation. The source keys tachypnea. Tachypnea specifically means abnormally rapid breathing, while deep or labored breathing may be described with other respiratory terms, so the wording should be reviewed. Question 95. The act of listening for sounds made by internal organs to aid in the diagnosis of certain disorders is called: Option A, menstruation. Option B, percussion. Option C, auscultation. Option D, palpation. The correct answer is option C, auscultation. Explanation. Auscultation means listening to internal body sounds, usually with a stethoscope, such as heart, lung, and bowel sounds. Question 96. Which of the following is an example of a biohazard? Option A, spilling a chemical on a countertop. Option B, splashing of blood when a cap is removed. Option C, touching electrical equipment with wet hands. Option D, the potential for a fire to start. The correct answer is option B, splashing of blood when a cap is removed. Explanation. Blood is potentially infectious biological material, so a splash of blood is a biohazard exposure rather than a chemical, electrical, or fire hazard. Question 97. Which of the following drug administration routes is the most appropriate for a patient who has nausea and vomiting? Option A, nasal. Option B, buccal. Option C, sublingual. Option D, rectal. The correct answer is option D, rectal. Explanation. The rectal route can be useful when nausea and vomiting make swallowing or retaining an oral medication difficult. Question 98. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation. A material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 99. Issues relating to medical advances come under the heading of: Option A, malfeasance. Option B, religious freedom. Option C, bioethics. Option D, ethics. The correct answer is option C, bioethics. Explanation. Bioethics applies ethical principles to questions created by medicine, biology, healthcare technology, research, and advances in treatment. Question 100. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 101. A female patient came into the clinic for follow-up after a right-sided mastectomy with some removal of lymphoid tissue. What is the name of the condition that makes blood draw on the right arm not recommended? Option A, syncope. Option B, lymphostasis. Option C, anemia. Option D, hemoconcentration. The correct answer is option B, lymphostasis. Explanation. Lymphostasis means impaired lymph drainage and can occur after lymph node removal, which is why venipuncture is often avoided on the affected side when possible. Question 102. The function of the platelet is to: Option A, cause the blood to clot. Option B, fight infection. Option C, carry oxygen. Option D, carry nutrients. The correct answer is option A, cause the blood to clot. Explanation. Platelets are essential for primary hemostasis because they adhere to damaged blood vessels, aggregate, and help form the initial platelet plug. Question 103. The invoice for the monthly rent of the building where the medical office is located is typically handled by which department? Option A, compliance. Option B, human resources. Option C, accounts payable. Option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 104. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken: Option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 105. Telephone etiquette involves: Option A, remaining anonymous to avoid any responsibility. Option B, leaving a person on hold until you have the answer. Option C, referring an emotional caller to the administrator. Option D, keeping your statements simple and to the point. The correct answer is option D, keeping your statements simple and to the point. Explanation. Clear, brief statements make telephone communication easier to understand and reduce confusion, especially when giving routine office information. Question 106. What is the appropriate test used for heparin therapy? Option A, point-of-care testing. Option B, activated partial thromboplastin time. Option C, hemoglobin and hematocrit. Option D, serum separator tube. The correct answer is option B, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is commonly used to evaluate the effect of unfractionated heparin on the blood clotting process. Question 107. Protected health information stands for. Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is option A, protected health information. Explanation. Protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 108. How many electrodes are used as part of a 12-lead electrocardiogram? Option A, 10. Option B, 6. Option C, 12. Option D, 8. The correct answer is option A, 10. Explanation. A standard 12-lead electrocardiogram uses 10 electrodes to generate 12 electrical views of the heart. Question 109. Which is the most common route of administration of nitroglycerin? Option A, intravenous. Option B, intradermal. Option C, suppository. Option D, sublingual. The correct answer is option D, sublingual. Explanation. Sublingual nitroglycerin is placed under the tongue for rapid absorption, which allows a quick effect when it is prescribed for acute angina symptoms. Question 110. A patient came into the doctor's office with chest pain and shortness of breath. Which position is the best to help him breathe better? Option A, lithotomy. Option B, prone. Option C, Fowler's. Option D, supine. The correct answer is option C, Fowler's. Explanation. Fowler's position raises the head and upper body, which can improve chest expansion and make breathing easier for a patient with shortness of breath. Question 111. Mr. Smith is suffering from an enlargement of the bones in the entire skull as well as in the hands and feet, in addition to thickening of the skin. Which of the following conditions is Mr. Smith suffering from? Option A, Addison's. Option B, Cushing's. Option C, acromegaly. Option D, cretinism. The correct answer is option C, acromegaly. Explanation. Acromegaly results from excess growth hormone after the growth plates have closed, producing enlargement of the hands, feet, facial bones, and soft tissues. Question 112. A routine hand wash procedure uses plain soap to remove soil and transient bacteria. Option A, scrub brushes. Option B, antimicrobial soap. Option C, gel-based creams after the routine hand wash. Option D, medicated towels for drying clean hands. The correct answer is option B, antimicrobial soap. Explanation. The source keys antimicrobial soap, but the stem states that routine handwashing uses plain soap. This item is internally inconsistent and should be reviewed against the original course material before use. Question 113. Which of the following would be filled second? Option A, Tommy Turner. Option B, Thomas Turner. Option C, Tom A. Turner. Option D, Tommy Turner. The correct answer is option C, Tom A. Turner. Explanation. The keyed filing order places Tom A. Turner second when the names are alphabetized according to the filing rules used in the source material. Question 114. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 115. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed.